This film will explain how using contraception can help you plan healthy and safe pregnancies.
Maybe use examples.
Sexual health expert Dr. Sue Mann will tell us why it is so important to plan your pregnancies, and she will start by explaining why it is particularly important for younger women.
Having babies before the age of 17 can put women at much greater risk of complications in pregnancy and childbirth, or even of going on to lose the baby or to die during childbirth. Women's bodies need time to recover between pregnancies. And also women who have more than 4 children are more likely to experience bleeding and other problems in childbirth and even death. Using contraception can help prevent against these problems. Sometimes people worry that knowing more about contraception might encourage people to have more sex and to have sex earlier, but we know that this helps people to make safer and more careful choices.
Dr. Sue Mann met with a group of young people in the United Kingdom to explain some of the different types of contraception available.
We're going to start off by talking about condoms. It's important to check that you've got a new condom every time you have sex. They're made of rubber and they go on the erect penis just before someone's going to have sex. So you can see there's this little bit at the end that you squeeze the air out of. Okay, so you can see that when this is on the penis, it actually stops the sperm going into the vagina. The sperm's actually caught in the condom as it comes out.
Do you have to have the condom on during the whole period of sex?
It's really important that it goes on before sex starts and stays on the whole time through. And you may know that sometimes a little bit of sperm can escape from the penis before ejaculation actually happens. And of course, it's important that at the end of sex, when you take them off, that you carefully remove them and dispose of them so you don't spill any of the sperm inside. Does anyone know what this is?
Is it the coil?
Good, okay. So it's put inside the womb by a doctor or a nurse who's specially trained, and then it sits where a baby would normally develop. It sits in the same place.
Does it hurt your body to use the coil?
No, these are very, very safe. They're used by lots and lots of women worldwide. But once it's in, you shouldn't know it's there. This is an implant. And again, it needs to be put in by a doctor or a nurse. You'd go to your local clinic and it would be put into the inside of the arm, just under the skin, and it can stay there for 3 years. And what it does is stop the ovary releasing eggs, so you can't get pregnant.
Are there any side effects from putting an implant in your arm?
It's very, very safe, so it doesn't cause women long-term health problems, but women do experience a change in their periods. The next method we're going to talk about is the injection. Like any injection, it can go in your arm or in your bottom, and you need to have it every 3 months. And it works very, very well. And they do the same as lots of these different methods, which is stopping the ovaries releasing an egg. So we're going to talk about pills now. Do you want to hand them around and have a look? And you can see there's quite a lot of pills in that packet, and it's because they need to be taken every day. And it's really, really important that you remember to take them every day for them to work properly.
How does the pill stop you from getting pregnant, and is there any side effects?
The pill works by stopping the ovaries releasing the egg every month. Most people don't experience any side effects with the pill, and people continue for years and years without any problem at all. So all these other methods of contraception do prevent against pregnancy, but don't prevent against sexually transmitted infections or HIV. Condoms are really the only method that does both. But the thing about all these other methods of contraception is that when you use them and then you stop using them, you'll return to being fertile and able to get pregnant again at the end of it.
Choosing what contraception is best for you is something that you and your partner can decide together. Using contraception to plan the timing and number of your pregnancies will help keep you safe and healthy.